Mr. President, I want to follow on with the discussion which Senator Ayotte from New Hampshire was bringing to the Senate floor. What she is saying is just so accurate in terms of the pervasive nature of this opioid-driven epidemic, pandemic in the United States of America. And it's time for us to come together in a bipartisan fashion to deal with what is now the great medical storm sweeping across this country. There has been a quadrupling of opioid-related deaths just in the last 14 years in our country. This is something that has to be understood. I heard Senator Ayotte mention it, but you can't say it enough, that 80% of all people in the United States who die from heroin overdoses begin on prescription painkillers, opioids, that have been given to them by physicians. Say that again. 80% of the people who die from heroin overdoses started on prescription pills, but they got addicted to the prescription painkiller. It deals with the same receptors in the brain. It creates the same kind of need in the brain. And when people get addicted to prescription pain medicine, it's a very short step ultimately to a product which is much less expensive, heroin, on the streets of the United States. This epidemic has to be dealt with, and it has to be dealt with where it starts. And it starts at the FDA. It starts at the Food and Drug Administration. It starts with the agency that approves these drugs for sale in the United States of America. Yes, the FDA stands for Food and Drug Administration, but over the last 20 years, it really stands for fostering drug addiction. And it has to end. And that's why the nomination right now of Dr. Robert Califf to be the new head of the FDA gives us an opportunity to talk about this issue, to talk about where it all starts, how it began, and what we're going to have to do in this body to reverse this trend, which last year led to the death of 30,000 people in our country. And again, I say to you that between 2000 and 2014, the heroin overdose death rate has quadrupled in the United States of America. So this is something that's recent, it's related to the FDA, and we have to now have an honest discussion about the role that agency is playing, because we have become the United States of Oxy. We have become a nation of 5% of the world's population that consumes 80% of the prescription painkillers in the world. And this overprescribing, this consumption of Oxy and Percocet down the line has led to this epidemic, this contagion that is killing people on a daily basis in our country that otherwise would never have even contemplated using heroin, using any of these other more dangerous drugs. So that's why we're out here. That's why I am recommending a no vote on Dr. Robert Califf. The FDA has a chance to change its policies. Thus far, it is saying that it will not change its policies. In 2012, healthcare providers wrote 259 million prescriptions for opioid painkillers. That's enough for every single adult in America to have a bottle of these pills in their medicine cabinet. And you should just understand that as we talk about this, that the molecular composition of OxyContin is very similar to heroin. In fact, oxycodone is the sole ingredient in OxyContin. OxyContin really stands for oxycodone continuously in the bloodstream of the patient who is taking these pills. It creates this sense that you're able to deal with the pain. It creates this sense that you are being taken care of. But if it's not handled correctly, over time, it then creates an addiction. And that addiction then leads to, once you're off these pills, to be out on the street and buying the heroin or buying the oxy that you need in order to continue this habit. So we just have to start to deal with the issue very realistically in terms of this pathway that has been created into the minds of millions of people all across this country. 1,300 people died in Massachusetts in 2014 of the 30,000 people who died in our country on this issue. We have the FDA going back to the year 1996 accepting the misrepresentation of the pharmaceutical company Purdue, which represented to the FDA that OxyContin, in its original formulation, was abuse deterrent, meaning that since it was time released inside of the patient, that therefore it was abuse deterrent and it could be prescribed safely to people all across our country. Well, it turned out that not only was that a misrepresentation to the FDA, but Purdue Pharma subsequently was fined millions of dollars, and its executives punished for the misrepresentation that they made to the Food and Drug Administration. That's a brief 20 years ago, but that's pretty much where it all started. That's the original sin, accepting this whole notion of abuse deterrent. Now, let's go to the FDA in more recent times. In 2012, there was a new opioid that the FDA had to consider for approval. That new opioid's name was Zohydro. Now, what the FDA did was they impaneled 13 experts to examine that drug for the FDA. When those 13 experts concluded their examination of the drug, by an 11-2 vote, the expert advisory panel voted no. Do not allow this new Zohydro drug out onto the marketplace. They said that the standards for abuse are too low. The standards to deal with addiction are too low. The standards to deal with diversion of the drug, too low. What did the FDA do in 2012? It approved Zohydro for sale in the United States over the objection of the advisory panel that had voted 11-2 against it. And these are experts. Moving forward, the FDA decided to re-examine what it was going to do. And so when it was considering Tajinique, when it was considering Hyzingla, it decided to solve the problem by having no expert advisory panels, which it would convene to examine the impacts of that drug before it got approved. That's a good way to solve the problem. Just accept the representations of the company that it had abuse deterrent in it, and then you don't have to worry because you won't have to talk to experts on the outside again. And so those two drugs got approved. And then in August of 2015, there was an application by Purdue Pharma, once again. That company's name just keeps coming back into the equation. They wanted approval to sell OxyContin to children age 11 to 16. Now, mind you, the actual standards at the FDA require an outside expert panel to look at approval for opioids being sold in America if it's controversial, if it could have a huge social impact in our society, and it specifically says in the FDA's own guidelines, if pediatric dosing, if what the proper dose for a child is involved, then the FDA should have an expert panel. What did the FDA do? The FDA decided no expert panel would examine the appropriateness of having OxyContin being prescribed for children ages 11 to 16 in our country. No expert advisory panel. Which brings us to the nomination of Dr. Robert Califf. We are now in a process where we're examining his nomination, his qualifications. I leave aside his own personal qualifications. It's not a debate really over Dr. Califf at all. It's a debate over the agency. Because the agency is saying, even today, even as we will be voting on Dr. Califf's nomination, the FDA is saying they will not change. They will not convene expert outside advisory panels to look at this new generation of opioids with quote-unquote abuse deterrents built into them to determine whether or not they are actually appropriate for being put into our society. And so today's the day to really begin this debate. This nomination is the occasion that we can use in order to debate what has gone wrong at the Food and Drug Administration. Because if we don't start there, if we don't start with a brand new definition that gets created for abuse, for addiction, for what the standards should be for the use of these opioids, then this issue is just going to escalate and escalate and escalate until we're losing a Vietnam War's worth of people every single year in the United States. This is a pharmaceutical industry-created problem. This is a physician-created problem. This is an FDA-created problem. It is created by men and women. It can be solved by men and women. This is not Zika. This is not Ebola. This is not some disease that you can't really point to who it is that's responsible for it. This is us. This is our country. This is our culture. This is who did it. We did it. We created this problem. 5% of the world's population consuming 80% of all opioids. Crazy. I mean, really, it's crazy. So we have to finally come to the recognition that this is no longer some inner city heroin epidemic. Now, this disease knows no age barrier, no racial, no income, no geography, no employment, no barriers at all. It's spread across every single segment of the American population, top to bottom. No discrimination whatsoever. And so for us, we just have to decide what are we going to do in order to make sure that we put the proper safeguards in place. So Senator Manchin and I, Senator Ayotte, Senator Sanders, Senator Blumenthal, other senators have been raising these questions. To the credit of the Senate Judiciary Committee, they are considering legislation to bring out here on the floor, and I thank Senator Whitehouse and Senator Portman and Senator Shaheen and Ayotte and Senator Grassley and Leahy for their work on that legislation. But that legislation does not include anything on this issue, which I am talking about right now. This has to be solved by the FDA. And that's why I put a hold on this nomination, saying that they will not get this nomination out here on the floor until they change their policies. Until they change their policies. We're in the 8th year of this administration, and the policies still remain in place. Abuse deterrent is really a contradiction in terms. It's really a contradiction in terms. If you take these pills, you're a carpenter, you're an iron worker, you've got a bad back, and you start taking these OxyContin pills right now, and you take them even as they're prescribed, and you just keep going month after month after month, you're increasing on a daily basis the likelihood that you're going to become addicted to these pills. And we've all heard these stories over and over again, the pathway in from these family members who come into our offices, and they talk about the pathway in that their child, their husband, their son took. And it all starts with the same story. They were given the prescribed pills. And right now, the industry is saying, don't worry, they're abuse deterrent. Well, tell that to these family members. Tell that to the families who have lost their loved ones. They're not abuse deterrent. They're not abuse deterrent. They're not abuse deterrent. It's a contradiction in terms, like jumbo shrimp. There is no such thing. You need to just be realistic about what this drug represents once it's consumed over and over and over again by people in our country who think that the doctor has given them a pill, given them a bottle that's going to help them. And that's one of the stories I think that we all hear over and over again from family members. They say that they question themselves. Could they have done more themselves to help their family member before they became addicted? And the common theme from each of them is, you have to assume that when a doctor is giving you a bottle of pills for your family member, that it must be good for them. It must be good for them. And it turns out, for 30,000 people, just in 2014, it wasn't good for them. And this number is just going to continue to escalate because we haven't put tough enough standards on the books in order to deal with these issues. And by refusing to convene expert advisory panels to come in and to create the guidance which is going to be needed in our country going forward, we are going to have a continued flood of opioid deaths that could have been stemmed if we had dealt with this issue in the proper fashion. So this is not a hypothetical concern. The policy announced last week by the FDA would not have guaranteed an advisory panel for OxyContin on the market today. The FDA must change its decisions not to seek expert advice against the risk of addiction before it approves any and all opioids. So I'm going to tell a little story. It's a story about maybe one of the 5 greatest basketball players to ever come out of the state of Massachusetts. His name is Chris Herron. And Chris became a Boston Celtic, the greatest basketball player in Fall River history, drafted in the first round by the NBA, went to the same college I went to, Boston College. I want to give you an excerpt from remarks he recently made here in D.C. at the Unite to Face Addiction rally on the National Mall. Here's what Chris Herron said. He said, "I truly believe that when it comes to prevention and education of our children, that we need to stop focusing on the worst days and start educating about the first day. At 18 years old, on the campus of Boston College, I was introduced to cocaine. I promised myself one time, just one line. That one line took me 14 years to walk away from. Despite myself, at 22, my dream came true. I was the 33rd pick in the NBA draft, but that same year I was introduced to a little yellow pill of 40 milligram OxyContin that cost a $20 bill. That 40 milligrams turned into 1,600 milligrams a day. And that $20 became $20,000 a month Oxy habit. And just 2 years later, that pill turned into a needle, and that needle stayed in my arm for the next 8 years. I often say that if you can't find it in your heart to have empathy for someone who is battling their illness, then you must know that he or she has a mother, father, son, or daughter that is at home with a broken heart that wants them back. Just one pill. Lives impacted. Some recover, many are lost. Another story. Caitlin Oberly from Situate, Massachusetts. Here's what she says. She says, I have survived a fatal opiate overdose, yet I have never abused opiates. On November 13, 2015, I spoke to my 27-year-old brother for the last time. Less than 30 minutes after our final conversation, he passed away from an opiate overdose. He was 16 years old when he first encountered the demon that consumed the better part of his adult life. Sadly, that same demon ultimately killed him. Injuries from a dirt bike accident left him with 2 broken arms, a knee injury, and what felt like an unending supply of prescription opiate painkillers. After his bones mended, he was left with an untreated, gaping, open wound that would never fully heal itself, an opiate addiction. During my brother's recovery, he painted a picture for me of how easy it was for him as a high school teenager and student athlete to call his doctor and request refills for his pain pill prescriptions. When he no longer had injuries to substantiate a prescription, he turned to illegal forms of opiates in both pill and intravenous form. Unfortunately, the damage to his brain had been done. There are many facets to what may cause someone to become addicted to opiates, and there are equally as many angles of attack before there is substantial progress to a viable solution. Mr. Senator, she wrote in the letter, I am writing to you because I am a survivor. I've lived through my worst fear by knowing that I can be a voice in helping prevent future deaths caused by opiate addiction. As you convene to debate the fitness of Dr. Robert Califf's nomination for head of the Food and Drug Administration, please ask the Senate to reflect on his time as Deputy Commissioner. As second in power at the FDA, he has had a chance to do something about these issues. It is time for a change in culture at that agency. And a third letter, a final letter. It's written by a Stephen Jesse from Malden, Massachusetts. Here's what he says. I am writing to you as a longtime Maldonian and a father of a 33-year-old daughter, Stephanie, who passed away on December 13, 2015, of a heroin overdose. Stephanie overdosed on Thursday, 2 days prior to her death, and was released by the hospital at 11:39 p.m. onto the streets. We've experienced this firsthand many times. Thank God for Chief Campanello of the Gloucester Police Department, who picked up the phone, talked to us, talked to Stephanie, and assisted us in every way they could to get her into treatment. Everybody else just said, sorry, there's nothing that we can do. I believe that our medical community, along with the pharmaceutical industry, are grooming and developing drug addicts and putting them right into the hands of the cartels and the drug dealers. Way too many prescriptions are written for more narcotics than are necessary after surgeries with no follow-up. Many of those who are predisposed to addiction, either by genetics or coexisting mental health issues, are easy prey for those drugs that begin as legally prescribed. Once they are addicted and can no longer afford the medically prescribed version of the medication, they fall into illegal drugs, and from there, too often, the addiction has taken control of their lives. The pharmaceutical industry, along with our medical community, has to prescribe these highly addictive narcotics much more carefully and offer less addictive medication wherever possible. Most patients take these narcotics for just a couple of days after the surgery, but are provided a much longer supply where they can easily fall into the hands of the addict. Our legislators and government officials cannot be tied to the desires of the pharmaceutical lobbyist. So this is the cry that's coming up from every community in America. Just individuals saying, how did this happen to my family? How could that accident with the broken leg or the back pain turn into an opioid overdose? How could it have happened? Well, it happened because the medical community and the pharmaceutical industry have not put the protections in place for us to be able to deal with it. Let me give you this number. This is a crazy number. It's a crazy number. Over the last 15, 20 years, there's been a dramatic increase in the number of prescription opioid pills that have been allowed to be sold in America. So I'm just going to ask people who are listening to this, pick a number. How many 10 milligram prescription opioids were allowed to be made in America last year? Just pick a number. We have 300 million people in America. How many of these pills were allowed or given the permission to be made by the pharmaceutical companies? Here's the answer: 14 billion. Can I say that again? 14 billion opioid pills for our country? The numbers are out of control. The overprescribing is out of control. We have to find a way to reduce dramatically the amount of drugs that are being sold legally in our country. Before we ever reach illegal, you have to start with legal. And that's the problem, because the Drug Enforcement Agency, the agency responsible for deciding how much each pharmaceutical company can manufacture each year, doesn't even announce how much each company is given permission to manufacture. Instead, they just announce the gross number of total opioid materials that can be put into pills in our country each year. Does anyone really understand this in America, that that's the process? The FDA allows the company to sell it, then it goes over to the DEA, and then the DEA picks a number of pills that can then be sold, and then physicians are allowed to prescribe these pills. But this is the FDA's own number. Listen to this. The FDA asked for voluntary guidelines to be put together for physician education so that they know what they're doing with these opioids. Pick a number in your brain as to how many physicians have voluntarily accepted medical education on the consequences of prescribing opioids. Pick a number. Here's the correct answer: 10% of physicians. That's it. 10%. On something that's so catastrophic, something that is creating an epidemic in our country, you would think that this was mandatory, that the medical associations at the state level, the national level, had created some kind of mandatory education. Hasn't happened. Is it mandatory in medical schools across America that they receive education as to what the consequences are of the prescribing of opioids? Not at all. And so, who would think that a physician would have to be trained in how to handle pain? I mean, a physician's only dealing with the issue all day long, every single day. You would think that there would be some understanding then of what the consequences were of the medicines that they were prescribing. No courses in medical school mandated. No courses after you've graduated and you're practicing medicine and now you are licensed by the DEA to prescribe opiates. No courses. So as we move forward here on the legislation that's going to be coming out on the floor of the Senate, I intend to make an amendment. Senator Blumenthal and I tried to make it in the Judiciary Committee, and we're going to be making it out here on the Senate floor, requiring the Drug Enforcement Agency to require mandatory education for any physician that wants to prescribe these drugs. That's the minimum that the medical profession should have to accept as a responsibility before they are allowed to prescribe these drugs. There's another amendment which I'm working on with Senator Paul of Kentucky, and that's an amendment that's going to increase access to medication that can help people to deal with their addictions. And again, that's a classic example of a Democrat and Republican working together on these issues. Senator Ayotte and I have an amendment that would create a Good Samaritan protection for any American, any family member that wants to apply Narcan to a family member or someone who has overdosed and will die in the absence of Narcan, the antidote being applied to them. Senator Ayotte and I are working on that amendment. We're trying hard to find ways where, unfortunately, legislatively, we can act. This should have happened at the agencies. This should have happened in the medical professions. We shouldn't be forced to debate this out here on the Senate floor, but it is absolutely indispensably necessary for us to take this action. This is the epidemic of our time. The death rates now in the age group that is affected by this epidemic are now declining at the same rates as they did during the war in Vietnam. We haven't seen anything like this since the war in Vietnam in the death rates. 30,000 people, quadrupling in 14 years, escalating on a daily basis. It's time for the Senate to take real action on this issue so that we can deal with it. Up in Gloucester, Massachusetts, we had a police chief who saw that something had gone wrong. Chief Campanello. He said that incarceration doesn't work, and instead, treatment should be substituted. So beginning last June, what Chief Campanello said in Gloucester, Massachusetts, is that if you come in and you're an addict, you've got a problem. You come into the police station, you bring your drugs with you, we're not going to arrest you, we're going to put you into treatment immediately. No arrest. 400 people have walked into that police station in Gloucester, Massachusetts in just 8 months. 400 people. Shifting the paradigm from arrest to treatment. 800 more people, 800 total across the country, as city after city, town after town adopts this model, have now accepted that as a better route for them in their lives, to just turn themselves in at the local police stations. He's partnered with a man named John Rosenthal. John Rosenthal is an activist in our state, and he helps to fund this program. And last Wednesday night, tragically, John Rosenthal's own nephew, Nathan Huggins Rosenthal, age 34, died of an overdose in Calgary, in Canada. And my heart goes out to the Rosenthal family because obviously they were committed to dealing with this issue, pioneering ways to have addicts be able to have a place where they can go. And yet in John Rosenthal's own family, his nephew overdosed just last Wednesday night. As Senator Ayotte was saying, there is no neighborhood immune. There is no family that is completely protected. This epidemic has been created by pharmaceutical companies, by physicians, by the agencies responsible to deal with it, and it is now time for us to put in place the protections which are needed to deal with it. Let me just give you an opioids 101, just so you can understand how we get to this. What are opioids? How do they work? And why do they lead to heroin abuse? So here's how it works. It starts with a seed pod of the opium poppy. We get the morphine, a naturally occurring opiate pain reliever, from that pod seed. The morphine interacts with so-called opioid receptors that are found in high concentrations in areas of the brain that control pain and emotions. Taking opiates can increase the levels of dopamine in the brain's reward areas and produce euphoria or a rush for pain relief and relaxation. In fact, morphine, which was first identified in the early 1800s, is named after Morpheus, the Greek god of dreams. In 1895, the Bayer Corporation, Bayer aspirin, the Bayer Corporation in Germany introduced a new cough suppressant marketed as a safer alternative to morphine. This new wonder drug was called heroin. In the 1920s, drug manufacturers began making fully synthetic analogs to morphine. They were called opioids. These drugs contain the same basic chemical framework as morphine. And they have exactly the same mechanism of action in the brain. They share common chemical features that allow them to bind to the brain's opioid receptors, and they all are considered highly addictive. These drugs vary widely in potency. That is, the amount of the drug required to reach the same level of pain relief and sedation as morphine. OxyContin, for example, is 150% as strong as morphine. Heroin is also an opioid. They share the same fundamental chemical structure. Heroin binds to the very same receptors in the brain and produces the same euphoria and sedation. And heroin is plagued by the same addiction potential. Heroin is classified as a Schedule I drug, the most dangerous class, because it has no accepted medical use and a high potential for abuse and addiction. So this is the pathway between opioids and heroin, and why that pathway is very short. It's all about the chemistry, because OxyContin has the nearly identical molecular constitution as heroin. And over time, the brain, the receptors, are saying, I need to continue to have that hit. And thus we have this epidemic where 80% of all people in the United States who are dying from heroin overdoses started on prescription opioid drugs that had been prescribed by their physicians. Physicians should have to be educated. The FDA should have expert advisory panels that give the strongest possible guidance to the pharmaceutical companies. That's what's missing in this equation. It starts there. We need a debate on $1.1 billion for more treatment and more education, and we're going to have that debate out here on the Senate floor. These local families, these local groups, they're heroes, but heroes need help, and it's time for us to fund those programs in the same way that we funded the Ebola crisis, in the same way we're being asked to help to fund the Zika crisis. Well, we have a crisis right here in America ourselves. But if we don't deal with the issue right from the beginning, at the FDA, at the DEA, at the AMA, we're not going to solve this problem. We're just putting medical facilities in place to deal with the consequences of having no policy. So this is our great opportunity to have a debate in our country. And I can't thank the members enough for beginning to deal with this issue on a serious basis. But we can't be afraid of the pharmaceutical industry. We can't be afraid of the American Medical Association. We can't be afraid of the bureaucrats in these agencies that say, oh, Mr. or Ms. Senator, we are the experts. You don't know what you're talking about. Well, just let me tell you this. The people of the United States don't trust the experts anymore in these agencies. They want more accountability. They want other experts to come in to check those experts, to ask the tough questions on behalf of the American people. And that's why I have a hold on Dr. Robert Califf's nomination for the FDA, because right now the FDA is saying it's going to continue business as usual. And that's just wrong. That's just plain wrong. It has to start there. The signal must come from this administration. So I thank all of the members for this discussion, for where we are today and where we're going to have to go in the months ahead. But I don't think we should end this year without a fundamental change that has taken place in our society, in this relationship. And I'll just add one final issue, and that's the issue of how many pills a doctor can prescribe initially to a patient. We're now debating that issue in the state of Massachusetts. Governor Baker has been saying that it should only be 3 days worth of pills. One of the counter proposals is 7 days of pills that can be used by the patient. But I do know this, we have to start here, because right now doctors are handing out bottles of 60 to patients who only need a week's worth or 3 days worth. When you leave a dentist's office, you don't need 60 days worth of pills for your wisdom tooth that have been removed. When you've got some pain that you just got from playing a softball game and you've twisted your back, you don't need a bottle of 60 or 30. You might need few pills for 3 days or 7 days, but you don't need the 60. Having that 60 in your medicine cabinet is the beginning of the problem. So I thank Governor Baker for what he's doing on this issue. They haven't resolved it in Massachusetts. I think we have to debate that here in the halls of Congress as well. They're all related, how these pills get into the blood system of our country. And so, again, I thank all of the members for their consideration of this issue.